In the UK, there are over 1.1 million children with disabilities. These are children with impairments that affect their ability to perform daily activities in the same way as other children. There is considerable evidence to show that more mothers of children with disabilities experience symptoms of stress and depression compared with other mothers, and that their symptoms are more extreme. For example, 30% of mothers of children with disabilities have symptoms of depression compared with 19% of mothers of typically developing children. And the difference in the health of these mothers emerges when the children are very young and continues beyond the age of 5. However, the evidence varies as to whether these symptoms are clinical, meaning whether or not their symptoms are so acute that they're affecting their daily lives. These are images from Henny Beaumont's graphic novel, Hole in the Heart, in which she describes the process of adjusting to her daughter Beth's diagnosis of Down syndrome. She describes extreme distress, anxiety for the future, and feeling invisible to society. But not once does she say that she is depressed or that her stress levels are unbearable and she's going to the doctor. For 7 years, I worked with people with disabilities. One girl that I supported had severe learning disabilities, was in a wheelchair and non-verbal. I met with her for a few hours every other week to give her mum a break. This, and my other experiences, made me think about the high care demands experienced by these mothers, their stress levels, and how their health was being affected. My research answers 2 questions. What stress-related symptoms are mothers of preschool-aged children with disabilities going to the doctor about? And how often are they going to the doctor about these symptoms compared with other mothers? Most research has asked mothers to fill in questionnaires about their symptoms. My research is different because I'm using medical records to look at health behaviour. And I'm looking at a range of stress-related symptoms, including musculoskeletal pain, headaches, and sleep problems. In general, caregivers of someone of any age visit the doctor less than people who don't have caregiving responsibilities. And they are less likely to visit about psychological health than about physical health. I expect the same to be true of mothers of disabled children. My research will raise awareness of the hidden health of mothers of disabled children and provide evidence for doctors to more routinely ask these mothers about their symptoms of ill health. In this way, my research will make mothers like Henny feel less invisible and more supported by the healthcare system. Thank you.